Officials are seeing a spike in cases of a little-known respiratory virus called HMPV. Now, this virus causes many of the same symptoms as COVID, like a cough and sore throat. But despite not being as well known, HMPV saw a big surge in cases throughout the spring. John Chandler tells us what we need to know.
Feeling under the weather this spring? The CDC says human metapneumovirus, or HMPV, might be the reason.
Oh, really? Wow, I didn't know that.
Most were unaware of this respiratory virus, which can feel like a bad case of the common cold.
My mom last week had a really bad sore throat, and now my nieces are getting sick now.
And HMPV is going around. At its peak in mid-March, the CDC saw positive testing at around 11%. That's 36% higher than pre-COVID averages.
The virus doesn't cause a severe infection, so we don't really test it everywhere for every patient.
Dr. Marina Keller treats infectious diseases at Westchester Medical Center. She says HMPV symptoms are similar to other respiratory viruses: runny noses, sore throats, a fever, a cough, nasal congestion, and shortness of breath.
Most of the population, it's like other respiratory viruses, like what we call basically the common cold, but it can be more worrisome for people who have medical problems.
Those with weaker immune systems are more at risk, younger children and the elderly especially. And as the urgency of COVID fades, so too might our health precautions.
It seems like a common cold thing, but I would watch out, wear your mask, because COVID is still a thing.
We've stopped wearing masks mostly. Is that something that could be contributing?
It is definitely possible as we take our masks off, we get a little bit more lax with our common sense precautions with viral infections, that we do see more viruses.
Dr. Keller says use common sense. Stay home if you or your kids feel sick. And at the very least,
hand washing never goes out of style. It's really important. It prevents all kinds of viruses.